Imagine a battlefield anesthetic from the Vietnam War becoming one of the fastest antidepressants in history and transforming mental health care in our lifetime. That's ketamine, discovered in 1962, approved as an anesthetic in 1970, and just over 20 years ago, a groundbreaking 2000 study showed it lifted depression in hours, not weeks. Today, we're diving into 5 recruiting ketamine trials that take this fast-acting drug further, making relief last, personalizing treatment, and integrating it with therapy, aging, and brain science. As always, this video is for informational purposes only and not medical advice. We strive to provide up-to-date information. However, please do your own research and consult your healthcare provider before considering any clinical trial participation. Before we jump in, let's break down some terms to better understand how ketamine works. Ketamine blocks NMDA receptors. These are like gatekeepers for glutamate, a brain chemical tied to mood. One low dose, around 0.5 milligrams per kilogram of body weight, infused over 40 minutes, often leads to mood lift in just 4 hours, with about 60 to 70% response rate. Effects usually peak around day 7 and fade by 2 weeks unless boosted once again. Esketamine, a related nasal spray, won FDA approval in 2019 for treatment-resistant depression. Now, here are 5 new trials that are refining and building on that promise. As we cover these trials, feel free to leave a comment below if you have any questions, and I can address it in future videos. First up, we got the Mount Sinai KAP versus KAT trial. This one has 2 arms or 2 portions for it. The first arm is the KAP arm, which is 4 to 5 ketamine doses of 0.3 to 1.0 milligram per kilogram, plus a 2 to 3 hour talk therapy session designed to help patients integrate insights. Then there's the KET arm, which is ketamine only. The same dosing schedule plus basic psychoeducation. They're going to follow 70 adults with depression for over 8 weeks. So why does this matter? Psychedelic-assisted therapy is hot. Retrospective studies show effects can last 3 to 6 months when therapy is added. Next, we have maintenance ketamine for treatment-resistant bipolar depression. This is an open-label phase 2 trial where adults from 21 to 65 years of age get IV ketamine every 2 to 4 weeks over 12 weeks. The doses are 0.5 to 1 milligram per kilogram. Previous studies show repeated infusions can push bipolar response rates to about 63 to 73%. They're tracking depression, suicidal thoughts, quality of life, and any mania signs, making this one of the first chronic use studies in bipolar disorder. Number 3 is a phase 3 Bayesian adaptive trial for older adults, 60 plus, with treatment-resistant depression. They're testing ketamine doses of 0.1, 0.25, or 0.5 milligram per kilogram versus midazolam, an active placebo, to find which delivers greater than or equal to 50% reduction in depression at day 7. Early pilots showed a 48% response and even some cognitive boost, which is big news because older adults often have fewer safe options. Number 4, a phase 2 neuroimaging trial using MRI, MEG, and EEG to track how ketamine changes the brain in adults 18 to 65 with depression. By linking brain activity and blood markers to treat response, they aim for personalized ketamine therapy, so doctors can predict who will benefit before treating. And finally, the Cat-Mind study. Adults with treatment-resistant depression get a standard ketamine infusion, either with or without mindfulness exercises. Mindfulness, simple guided breathing, and awareness may enhance the antidepressant and psychological effects during that neuroplastic window. Make sure to drop a comment telling us which trial surprised you the most and why. We'll highlight the top answer in next week's video. These 5 trials are pushing ketamine from fast relief to longer-lasting, personalized, and mind-integrated treatments, from therapy combinations to age-focused protocols and brain-based approaches. Remember, we're here to share information, not give medical advice. Check clinicaltrials.gov, talk to your healthcare provider, and do your own research. If you want to stay in the loop, join our free newsletter at TheClinResearcher.com for more information on enrolling clinical trials. If you like this video, subscribe, hit the bell, and you'll never miss another video on new cutting-edge clinical trials. Until next time, feel free to watch one of these videos that YouTube is recommending for you.